Hi, I'm Dr. Pat Sager-Lane, and I'm also a gerontologist, and I study the process of aging all over the world. However, as I aged, I ran into problems with my eyes, an extreme dry eye situation evaluated by two other doctors, eye doctors, and I ran into having cataract surgery in both eyes, and then also having cornea surgery due to dysbiosis in my eyes. And I did both of those procedures. I ran into complications and had to use continuous eye plugs for extreme dry eye, was what I was told. And I had to have plugs in the top and the bottom every 60 days of my eyes, both eyes, which becomes cumbersome, which becomes a maintenance drug, which becomes something you rely on very much because you're afraid not to have the plugs in your eyes. It's also paid for by most insurance, including Medicare. And so therefore it's a procedure you go through. My eyes weren't getting any better. However, I realized that this was a forever procedure and I could not see the end of it. So I wanted to see what else might be still causing my cloudy vision, looking through a veil, and something wasn't right with my eyes. I still had dry eyes, even though I was doing all the drops, gels, and so forth that I was recommended to do, both over the counter and prescription. The cost became enormous to follow that regimen. Luckily for me, I decided there had to be another answer. I'm an active researcher as a health professional on the fringes of traditional medical treatment plans and an undoctored certified practitioner that uses health empowerment techniques to help people to get better without drugs. I realized there had to be somebody here in Jacksonville, if I was lucky, that could take a look at my eyes from a different perspective. I found Dr. Gulani online after reading everything because I'm a researcher about him and what his patients said about him. He solves the unsolvable eye problems, both vision and other problems, dry eye, whatever it is, from people all over the world that fly into Jacksonville for his expert surgeon advice as an eye surgeon. I felt I was lucky that he was here in Jacksonville. I came to see him, and the first thing he did was undoctor me. He insisted, even against my own desire, to get on with this and see if there's a YAG problem in the back of my eye or if there was a lens problem in the front of my eye that two other eye surgeons had maybe not done as well as they could have. He would do nothing, absolutely nothing, until he got me off of all the gels, all the drops, and all of the procedures that were happening for plugs in my upper and lower eyes. For months this had been going on. And I was resistant, I must tell you. I didn't believe it. I didn't believe I had a doctor that didn't want to do anything. Insisted on getting my eyes back to what he believed would be the real Pat, would be me, would be undoctored me. So since I am an undoctored professional, looking at health empowerment from healing the gut, nutritionally, this finally made sense to me that let's get me back to normal, even if it's uncomfortable, and I felt totally reliant on the other procedures. But my philosophy did match his, and I feel very gratified. I would recommend Dr. Gulani to anyone. He's going to get you back to normal as best he can, and then carefully and meticulously evaluate what's going on with your eyes. And that's what needs to be done without all of the additional procedures you may not need, all of the different pharmaceuticals you may not need, and all of the over-the-counter drugs and procedures you may not need. So I'm very happy to recommend him. I'll be very curious to see what happens with my vision as we go forward, and then maybe I can tell you the result at a later time.
So we're all done with the MGP, Pat. Now I'm just squeezing these open glands, and you can see all the horrible sticky material coming out of it. No pain, right?
No pain.
Wonderful. Sit back, please. We're all done.
It's amazing that I could feel this good 5 minutes later, and I was so excited to try this because everywhere else I looked, and I really did my research. I'm a researcher. I love health and nutrition, and I did the research. I went all over the internet. I looked at everything, and when I finally found Dr. Gulani, and he told me that I needed this procedure to probe my glands, upper and lower, and he was going to do both upper and lower on both eyes at the same time with no needle. No needle. I could have hugged you then because everywhere else is being done with needles to numb the eye. And he just did it with no needle and really a little discomfort, no pain. So thank you very much for doing that. And this is innovative. I love innovation. Of all of things, I love color and innovation. And Dr. Gulani is an innovator in everything he does.
Thank you, Pat, so much. To me, as you know, I approach dry eye like a disease spectrum. And thereby you can individualize your plan rather than putting people on all these cocktails, I call it, you know, medications, expensive things that you are put through, because dry eye people come with a lot of hope. It's very important to be responsible and reactive. Like you had been to previous doctors and the history that you gave me with all the products that you came with.
And procedures.
I feel MGP, meibomian gland probing, is something like, I correlate, the analogy is somewhat like treating pneumonia. You know, you're really getting to the root cause of the disease. Exactly. You're coughing, people are giving you Robitussin and NyQuil, but they're missing the pneumonia. Right. And so it recurs, and so it's constantly there. Or very much like even teeth cleaning, you know, do you really need teeth cleaning? No, but do you need it? Yes. So to me, at some point, meibomian glands, if they are blocked, especially in a female patient who's already suffering from dry eyes, it's the best way to give them back their own natural oils. The tear film is made up of the water layer, like we said, and the oil layer. There are other layers too, microscopically, but these are two clinically important layers. So you're a teacher, you teach about nutrition all over the world, so it's an honor, Pat, but we just finished your MGP and I'd like to know how you feel.
Wow. I feel comfortable and my eyes are not as dry as they were before we started. They're not itching, and it's just amazing that a simple treatment that doesn't hurt, no needles, remember? Needles. It doesn't hurt and you can feel this good this soon. I can't wait to see what tomorrow's going to be like.
Oh, it's been a real pleasure, wonderful journey. Thank you so much for the honor.
Happy Valentine's Day.
Oh, you too, you too. Take her to a nice restaurant today, okay?
You will.
Pat, how are you?
Hi, amazingly well.
Fantastic. So I'm seeing you today after your MGP.
Yes.
All your medications are done, and how do you feel?
It feels much more comfortable would be my favorite word. I haven't had any comfort at all in my eyes for a long time. I was reaching for just wetness drops, not lubricants because they always bothered my eyes and made it worse, but wetness drops multiple times per day. Now I can go to bed without them, I can wake up without them.
Come, let me take a look.
That phenomena is amazing to me.
Excellent, come. Eyes wide open. So your eyes look nice and comfortable. Pressing on the lids, good extrusion of pressure. Look down, please. Look straight. Beautiful tear film, cornea nice and clear. Looks very nice, Pat. Very happy with you. Make sure you use the warm compressors and the ocular hygiene.
I do, absolutely religiously, and the really, really cool thing is, I wish we would have done this first before I tried all of the other dry eye stuff out there. This should always be done first.
Again, I'm sorry for what you went through with your doctors, with all the treatments you had, but like I said, dry eye is more than just a one quick fix. And even though many surgeons you've seen and did all the techniques, whatever, I still feel the design is important. It has to be designed to you. So they use different techniques, technologies, but if it wasn't the right one for you, that's why results don't come that way. So I'm very pleased with the MGP we've done, and you're already doing well, Pat.
I'm doing great. Thank you for your intervention, help, and belief that you could fix it.
My pleasure. And travel all over the world, do your teaching. I'm very proud of you.
I will.
Excellent.
Thanks. Hi, I'm Dr. Pat Sager-Lane, and I am here at Gulani's, and I have just completed the MGP procedure about 10 days ago. And it is amazing what has happened to my eyes. I wish I would have done this first and not spent a lot of money on many other eye treatments and drops for over 3 years. And Dr. Gulani designed this especially for me, told me what he was going to do, how he was going to do it. There was no pain to the procedure whatsoever, and I would do it again if needed. If my glands clog up again for any reason, I highly recommend that you do your homework, do your research, start with this procedure, and come see Dr. Gulani. He'll fix you.